I wanted to say first, thanks for everybody that's joining us here today. And we'll go ahead and get started to respect everybody's time. My name is JD Mintz, CEO and founder of Nulife Virtual, one of the presenters and speakers today. And I've also have Tim Harrington, our Executive Vice President of Nulife Virtual and Head of Marketing. And we'll go ahead and get started. So Tim, go ahead and take it away.
Hi, everybody. Welcome to our webinar. It's our first webinar. We're super excited to be here and grateful that you're here as well. Before we get started, I was thinking about this. I think about this a lot, actually, and I just wanted to take a moment to first acknowledge the heroic efforts of frontline workers and those who are delivering care to people struggling with the experience of addiction and mental illness. We've all been challenged, but we have rose to the occasion to meet the extraordinary personal and professional demands of 2020. I'm humbled by the many stories that I see every day about people struggling yet also overcoming. We are strong and resilient, and we've proven that this year. So I just want to say that out loud. I think it's important as we come to the end of this year to really sort of acknowledge all of that that's happened. I know that I haven't done it regularly, and I wanted to do that in this forum. JD and I are here in this space for a lot of reasons, but primarily because we have a personal story of recovery, as well as a professional story from working in the field for a long time. Combined, we're at about 25 years in this space. And these two stories dovetail at Nulife Virtual. And that's what brings us here today, ultimately. Although slow to come around, addiction treatment has long been a target for technological innovation, with advocates highlighting the practical and infrastructural challenges presented by the more than 18 million people struggling with substance use disorder, yet still not receiving treatment. With COVID-19 proving particularly lethal among people struggling with addiction, the crisis has further illuminated the need for solutions that help those experiencing addiction and mental health challenges to recover at home in comfort, while also providing family and caregivers with comprehensive services and support like never before. Prior to COVID-19, some people who were experiencing addiction and their families were already embracing technology as a solution that would allow them to recover in their homes. Lion Rock Recovery has been delivering online services for about a decade. However, widespread adoption of recover in place strategies has been slow to take hold, largely because of the need for greater patient education and technological literacy among the target population until this year. With self-isolation and social distancing, the pandemic has presented a unique opportunity for a range of virtual care strategies to demonstrate the importance of their products and services. We clearly see that the opportunity at hand is for residential care facilities to take measures now to upgrade their digital and virtual care infrastructure and strategy. In addition to ensuring a powerful continuity of care for residents, consistent communication and addressing loneliness have become equally critical during COVID when clients leave residential treatment. Consistent communication is more critical than ever to maintain the gains made. Nulife Virtual, our app, has seen a large increase in interest amid the coronavirus pandemic. CEO JD says, by leveraging our technology platform, we are able to quickly and effectively take an addiction treatment center virtual and ensure that patients remain consistently connected to professionals, family members, and peers in recovery, even while physically separated. As tech-assisted addiction treatment and recovery support continues to prove its value to the field and the recovery community during the COVID-19 crisis, it will no doubt become an essential part of care delivery going forward. We are encouraging on-site care facilities to bolster investments in digital strategies in order to not only survive, but to thrive in 2021 and beyond. And personally and professionally, JD, when we first met, we really came together very quickly in terms of our alignment and our ultimate goals. And one of them is clearly outlined in our mission, and that is to impact 1 million additional lives, leveraging technology and collaborating with other people's networks, specifically treatment centers, to help make a dent in those 18 million people who, for various reasons, are not receiving treatment. We really believe that this is the way forward, to include more people in the process, invite more people to the healing process. So with that, I'm going to turn it over to JD.
Right.
And again, thanks everybody for being here.
Hey, Tim, thanks a lot, bud, for, the intro and try to make this, entertaining and educational and, a little bit more about my background. So we know who, a little bit where I'm coming from. Prior to, 2013, I was in the technology industry, various different, a couple of different tech companies that I had founded and taken to successful exits. And then I found myself struggling with addiction, alcoholism, and ended up, getting sober in February or March 17th of 2012. And that led me into the wanting to make a difference, and ended up opening some treatment centers in Southern California. And that journey, led me to where we are today with Nulife Virtual, our digital care platform. And I don't specifically want to talk about Nulife Virtual. It's not intended to be a sales pitch or a sales webinar for Nulife Virtual, but as a treatment center owner and operator, there were a lot of things that I recognized that weren't working well in what we were doing, and one of them is treating a chronic disease, using an acute care model. Another was trying to stay in contact and in touch with clients once they left our four walls. And that included having an outpatient program, but not really being able to stay connected in a 24/7 environment. And once I learned the treatment industry, decided to leverage my technology background and some of the technology team and people that I had put together the previous 15 years, in business, to go about start building an app and a platform that would help. Initially, I just wanted to help keep clients connected, our clients connected to each other, once they left treatment, because they gained they built these powerful relationships together. And that led us in 2017 to start experimenting and actually delivering telehealth online treatment in a pretty widespread basis in Southern California. And it proved to work. People liked it. So what we do now is purely digital. I'm completely out of operating brick and mortar space, and I want to take that knowledge and bring it forward to the industry, and then work with other leading providers, professionals, and inspirational influencers in our industry to positively impact those 1 million lives. And one of the things that we do is we deliver meaningful patient, client, and family encounters beyond teletherapy, using our palm of your hand mobile care addiction treatment and recovering support app for life. And again, as I said, this isn't about us, but it's an example of what treatment centers and treatment center operators need to look to do to future-proof their treatment organizations going forward. Because one of my favorite thoughts is back in 99, 2000 is there was somebody sitting around and said, "Hey, Jeff, who's going to buy a book online?" Right? And now we have Amazon, and Amazon's gone on to do some fantastic things. Amazon's also gone on to put a lot of brick and mortar only businesses out of business. And that's what we don't want to see our treatment providers happen to, our existing treatment providers, because that network of 14, 15, 16,000 plus treatment providers, across America is, critical to fighting, what we're going through today. And so for a good substance use disorder treatment center, we understand the challenges associated, and that's where that background comes in. And we understand that a good digital care platform needs to, work with other technologies that a treatment program is working with, including EMR and practice management systems, the ability for a treatment program to white label or brand so that their patients and clients and families and friends are comfortable interacting with them via a digital platform. It includes what the other fantastic thing that we've been learning over the past few months is just how similar the problem is globally. So, I was so focused when I was in the brick and mortar business in my surrounding areas, and maybe where patients were coming from other states, that I completely didn't really think about the entire global impact of addiction, on the world. And so now with technology, we're able to reach more people globally. So obviously internationalization of your technology is important. And offering advanced features for the provider, for the practitioner, because they're really the star of the show, right? The practitioner, the professional, from the counselor to the case manager, to the recovery advocate, they're the ones that are the star of the show. So that's what you really need to look for in a digital care platform is something that, a platform that's going to work with some of your existing technology tools. But today I wanted to also specifically talk about, because I remember originally starting treatment, my treatment program, and I thought karma was going to pay the bills. Karma was going to keep the lights on. And, for some reason, it didn't seem okay to, want to be able to make a profit and to be successful in treatment. And if we were, as business owners, thought of as focusing on generating income and revenue, that meant we were bad actors or bad people, and we weren't focused on the right thing. And that's just completely not true. While there are absolute bad actors and bad players, we have to, whether you're a nonprofit, for-profit organization, we have to be able to generate income and eliminate costs as much as possible to keep the lights on, to continue to grow, and to continue to provide access to care, improve access to care. And so today we want to discuss a specific scenario about what an organization can expect by implementing a complete digital care platform to their existing brick and mortar business. I mean, it's important to be focused on what we are discussing as opposed to the exact numbers, because those are going to vary based on your specific population, services, and reimbursement rates. Okay, so we're going to take an example of a smaller or a typical, I would say, 12-bed facility that averages about 10 people per month, or an 85% census rate in their inpatient. They spend about $4,000 per customer acquisition. So for every client they acquire, in all of the costs that they spend in acquiring that client, it's about $4,000.
Read it.
And they do, and this program does have a census of 16 on average outpatient. And they have a blended reimbursement rates, as mentioned there below. And so again, we don't want you to exactly focus on the specific numbers that we're showing you, but this is a scenario that we're running through. There's an incredible number of benefits with digital care platforms, as we've already talked about, that are being proven out each day. But in the next few minutes, I'm going to focus on 4 key areas that treatment organizations are able to utilize through a digital care platform to create new revenue streams while expanding existing revenue streams. So specifically, I'm going to focus on admissions, how to capture more admissions while providing more appropriate levels of care for those admissions, continuing care, so how to keep our clients engaged and involved with our program for life, alumni and families. So how to drastically improve our engagement and education of our alumni and family networks. And then finally, how do we create new revenue stream models by leveraging virtual care to expand with limited risk while improving outcomes, which we believe is the number one important thing, is we have to get better results. So again, in this study, we have a treatment organization that receives 100 calls per month and is converting 10 of those calls into inpatient care. So this is an incredible conversion rate. I mean, 10% conversion rate, these guys are doing an incredible job. But I look at what it also means, and it means that 90 people are being turned away. 90. And I understand that many of these calls may be information seekers or people just looking to chat, but they still deserve our help. And with a digital care platform, you can be of service to every single caller. I mean, I'm not saying that every single caller is going to become a patient at any level or is even appropriate, but you can be of service to everyone. And that's important to your why, and it's important to our why for sure. And you will be able to convert more calls into patients at more appropriate levels of care. And I say that because offering instant assessment options via digital care platform helps you more properly place or better place a client or patient into a level of care that they need versus trying to put them somewhere that they may not need, right? So not everybody needs detox, not everybody needs inpatient, but there's such a drive when somebody is calling into our treatment program or treatment center to get that person to get on a plane, get that person into our treatment center, because we believe that that's the only way that we can start this process. And it's just simply not true, in my opinion. In our case study, we are able to engage 9 more of these callers. So out of those 90 that we typically were not servicing, we're able to engage 9 additional callers that we're not going to travel, but would entertain entering into a digital or virtual intensive outpatient program or outpatient program of some sort based on an assessment they took on the phone through your app. Next slide. The second key area of focus is maximizing our continuity of care by making it easier, more effective, more convenient for clients discharging from our physical inpatient program to stick with their care team, to keep in contact with their peers once they leave your 4 walls. By offering a complete and engaging online programming community, not just Zoom links, okay? Community. All right. It's one thing to just offer a link on a calendar. It's another thing to wrap that link, wrap that online group, wrap that online session with a platform where people can engage with their peers of similar interest. Because when I went through treatment, as a 40-year-old male with a family and a business, I certainly know that when I was able to connect with peers of like mind, I was able to do better in my recovery, right? So I have interests above and beyond my alcoholism or my addiction, right? I like to hike, I like to work out, I like to read, and I like to connect with people with similar interests. So that's one of the important things you need to make sure that we get across is a digital care platform and a digital care program is intended to wrap the virtual online sessions, these Zoom sessions with community and the ability to connect with people regardless of their location. Next slide. Our third focus is on better servicing alumni and family network, which is almost always understood. And in a second, I'm going to ask Tim to engage here as well, but ask yourself when you shop or go out to eat, do your favorite businesses stay in touch with you? Do they offer their more products and services to keep you coming back? In most cases, don't you like getting updates or coupons or discounts or notifications? Hey, we've got this new menu item, or hey, we got this new item in stock. But why don't we, why don't we look at promoting and marketing and staying in touch with not just our alumni, but the family and the immediate network of our alumni as being positive, right? As staying in touch and keeping them engaged, both with online education, both with online sessions. I mean, Tim, in your years of practice as a family coach and interventionist and all of the other things that you've been successful in doing and treating people, what have you seen is the power of engaging family with the actual person going through recovery?
Yeah, well, for the last 12 years, I've been doing strictly work with family members, anybody who's affected by the drug use of someone close to them. And what I can tell you over these last 12 years is that a common frustration is the lack of inclusion for family members at a high level. Typically, they're instructed to stay cool. We'll get to you. We're really working with Johnny. And, it's very sort of dismissive. Not everyone does that, but typically in general, they have not gotten the same level of services and support necessary to affect the long-term outcome. And so what this allows us to do, which is one of the things I'm so excited about, is to give the opportunity for brick and mortar treatment centers, on-site residential care facilities, the opportunity to really raise their level of engagement with family members by offering these online communities, these professional services that can all be done digitally. Because one of the things that's very challenging for family members is that their lives are going on, they're continually working, their lives continue to go on while their loved one is in treatment. And so we need to take that into consideration. This creates the flexibility and the opportunity to address those barriers that they incur while they're trying to be as helpful as they possibly can. So I couldn't be more excited for this aspect of it. Thanks, JD.
Yeah, and I mean, it is so, families and the environments that we go back to that we grew up in, it's not always logical to say, hey, you can't go back into this situation or this environment. And so education is so important, but geography has in the past always played it always played such a limitation on what we could do with families, right? If I had a young adult or anyone that traveled to California to go to treatment, and their family was in Pennsylvania or their family was in Texas, it wasn't realistic to think that their family was going to fly out and have these sessions with us, right? And a lot of times, these families didn't know how to act or to react to what their loved one was going through, right? And so not only engaging in group sessions and bringing in the family dynamic online, but it's also about education, right? It's about connecting with other parents, other husbands, wives, sisters, brothers that have gone through the same thing, right? I mean, it's the whole premise of Al-Anon, right? It's hey, I want to relate. My daughter has gone through, struggles with addiction, is in treatment. Has anybody else been through that, right? There are, right? There's people that have been through that before, I'm assuming.
Yeah, no, there's no doubt. The community is important through the whole process of recovery is community. And also it's what you mentioned reminded me of something, and that is that the only perfect parents are the ones that don't have kids yet. So it's really important that we engage them on the front end, the sort of prehab situation. And that's another thing that admissions with a virtual platform like ours or any virtual platform allows you to engage them regardless right away, to get them involved in some activity that helps them feel less stressed. And you can do that using our platform. We can get them into a community within 24 hours so that they can start to feel a part of this process in a powerful way.
I mean, I think I think that's incredible. Like, because it's okay to make money if you're doing the right work, right? And your outcomes are measured and your outcomes reflect that you're doing the right work, right? I mean, you would agree, right? It's okay. If we're a business, it's okay for us to make money as long as we are making a positive impact. We can show those results, and we can show those results, not only to payers, to the public, but we can prove those results, but also to the people going through the treatment process.
Yeah, and again, it's like this is on a continuum, the continuity of care, continuum of care. This is not episodic. It needs to be continuous and consistent over time, because when people get back into the real world, so to speak, they're faced with these social determinants of health, employment, the relationships we're talking about with, all of their loved ones. Life is, I always likened it to, like, when you leave treatment, it's like stepping on a yard rake and it hits you right between the eyes that here's the real world and the things that are challenging you, just like everyone else. But we need that continual behavioral nudging that is allowed through, provided through a digital platform that continues to remind people as they're going through real life how to stay on course, how to stay connected, how to stay educated based on different levels of recovery that they're at, the beginning, the middle, and long term. They all present challenges. So if you have an app where you can treat people for life, we can address that continuum, and that's super powerful.
Yeah, and what about, like, continued continued education, continued tune-ups, as we call them, or whatever you'd like. I certainly know that as I go through life, I run into new challenges that I need help with, or I run into new things that trigger me sometimes to want to think about old behavior. And with a digital care app, we can do something that is much more powerful than the every once in a while phone call or bowling nights or barbecues, which are fantastic, right, as alumni events to bring people together. But not only are they not a reality in the COVID world, which we hope goes away at some point, but our behaviors have changed now. Our habits have changed, and they won't go back, guys. I mean, they will go back to a certain degree, and brick and mortar will continue to exist. But I will unapologetically say that if you do not adopt virtual care strategies, and you do not adopt a virtual care platform and program and communities and ways for people to connect with peers, both in professionals and professionals to professionals, you will go out of business, right? I mean, and that will just happen. And I can't tell you it's gonna be in a year or 5 years or 10 years, but I look at my kids. I have 2 teenage kids, and I look at the way that they communicate with their friends and the way that they interact with technology, and I can tell you, it comes right from their phone, right? I mean, it comes. I mean, I have to text my kids, and they live in the same house, to get them to come down to dinner. Okay, so we'll go to the next slide. Our last focus, I know we got a little bit off on a tangent, is expanding our offerings, right? And this is one where we need to really think about it. The ability to expand our offerings. This is something I did in 2018 with our treatment center, is when we started experimenting with telehealth. We went out to some local sober living facilities, and we said, hey, nobody was doing this. To my knowledge, nobody was doing this. And we went out to some local sober livings, and we said, instead of transporting your clients and your residents to an outpatient, let's just install a high definition camera here. Let's make this room HIPAA compliant so nobody enters in. And your residents can come sit on this couch, and on comes our facilitator, our therapist, our clinician, and we can treat these clients right here from your sober living environment. And then in addition to that, we're able to get back, because it didn't cost us anymore to treat those patients that didn't have insurance that were also living at that sober living environment, right? So we did a 2-for-1 program. So we provided, for every 2 people that were in treatment through insurance or private pay, we provided a free treatment, complete treatment program for as long as it took for somebody to go through treatment completely free of cost. And that speaks to the affordability of delivering digital care. So Think about the ability now to expand your offerings online and take advantage of all of the fantastic digital practitioners out there now. Now, so many more therapists, counselors, yoga instructors, nutritionists, dietitians have learned and been forced to, unfortunately, take their business online and go digital. That there's such a more skilled workforce out there, willing to run groups, willing to take on individual clients, willing to add ancillary services, and you don't have to bring them on as full-time employees, right? You can set up online treatment tracks, expand your offerings. Why not set up an executive program and approach, executives? Why not set a 55-year-old plus virtual program or an evening track? No longer are you restricted by your physical location and your physical space. And I know we're going to get all the naysayers. Well, we don't know about if we're going to get, reimbursed, or we don't know if we're going to get, we're going to get paid. And I can't answer every question. I mean, even while I was in treatment, I didn't know if I was going to get paid for a detox day here. I mean, it's no different than providing the traditional. We have our challenges in providing our traditional brick and mortar treatment models as well. But you have to think about, how do I expand my offerings with a limited amount of risk and grow that business? Next slide. So in summary, what we want you to focus on is not, your exact return on investment by, utilizing a digital care platform is not necessarily going to be, these numbers. They could be higher, they could be lower, and they could be they are very specific to the services you provide, your location, and definitely the size of your program and your population. But one thing's for sure, that a quality digital care platform will allow you to expand your services and, more importantly, improve measurable outcomes, right? And a digital care platform allows you to provide more accessibility to care services. This is the most important thing to me, at least. Providing more accessibility to people to get care, to provide more affordable care, right? And to better measure the success of the services we provide, right? And that's inherently built into digital care platforms, is the ability to improve access, reduce costs, and measure care much easier than we can in a traditional brick and mortar model. But again, I want to reiterate, our whole model is to enhance and build onto, to plug into, and to take advantage of all of the wonderful brick and mortar treatment programs in the country, and allow them to extend and take on a digital brand. It's not to replace them. So finally, wanted to open this up to some Q&A. And see if anybody had any questions from our audience.
Yeah, we have a few questions.
Yeah, I'm sorry. What's that, Tim?
That's Addison. Addison says we have some questions.
Oh, okay. Yeah, Addison, go ahead and tell us what questions we have.
Sure. We have a question from Jacob. They've asked, how do you see an app being used during the admissions process?
Tim, why don't you take that? I mean, I know you've talked a lot about how you
talked a lot
feel
about that. Yeah, again, this is really about stories, and there's a personal story of somebody who's struggling to find treatment for their loved one. A lot of people out there who are working to find the right place. And in admissions, we have an opportunity to really help that person no matter what, whether their loved one enters or not. That's really, the focus is on that person. And we can, with the use of QR codes, we can have that person download the app immediately, your app that's branded on the App Store, Google Play, and have them in no time in some community of support. It can be a community of support led by peers, or it can be a community of support led by professionals, on what you want to do. But the opportunity is there. This is an opportunity. Digital platforms like ours to in that person's, because one of the most difficult things for people is feeling scared about getting the help that they need and feeling lost in the in the worldwide Google. Like, it's just it's not a fun process. And if we can offer them some sense of safe harbor, let's call it, of a place where they can get involved immediately, feel calmer and feel more in control and more empowered, we should do that.
Yeah, I concur. I'll just add on, one thing is, in a real example, like, we put so much pressure as treatment center owners. A lot of times we're under our own pressure. And, when I was to, pay for our this big overhead and to pay for all these 5-star amenities that, people want and expect, that so often, even through trying to do the right thing, treatment centers find themselves, putting people in the wrong, levels of care. And so through using an app to get people involved in a community, and do upfront early assessments, we can do a better job of finding, the right location, and we keep them involved and engaged in that process. Instead of just a phone call, hang up, let me check your insurance, and getting back to them, several hours later, or 24 or 48 hours, or never. Any other questions, Addison?
Yeah, we have a question from Shannon. They're asking, how do you see families or loved ones being more involved in the process?
That's another one for Tim.
Yeah, we talked about that earlier. And again, I think this is next level stuff, and the standards have been fairly low in terms of the engagement and services and support for families. I had a father tell me on no uncertain terms to not talk to him about family programs because he could teach those psychoeducational programs for as many as he'd been to. He was looking for something more, and I think digital allows us to really deliver more. And I'm looking forward to that as much as anything, because they're usually the first point of contact in this process is a family member, a loved one, an employer. And usually they're the ones who are signing papers and everything just to sort of move the process along for the person who has the addiction. And meanwhile, they do not get carried along in the process as the way they should in order to really contribute to the long-term outcome. And we get to do that. This can deliver on that. The continuity and continuum of care applies not only to the patient, but to the family. And I think that's just, I can't be more excited about the possibilities of that for people who adopt a platform like this, to be able to really, really deliver on the promise of helping the family system.
Couldn't agree more, Tim. We have another question from Alex, and they're asking, how would we access and utilize outside clinicians or facilitators if we wanted to expand our virtual offerings?
It's a great, it's a great question. One of our, well, number one, what I did as an example in 2017 and 18 was, literally place, job ads for people for professionals that were looking to add, 6 to 10 hours of group facilitation or individual therapy sessions to their practice, and letting them know that they could be located. At the time, we wanted them located in California, but we didn't care where in California. And we were overwhelmed with the number of applicants from very qualified people, many more than we got if we were placing trying to recruit and hire people to come on site to our facility, which was a little bit more difficult to get to. With respect to the digital care platform, what we're going to be doing, I'll speak to that, is we're going to be offering the Nulife virtual app to practitioners of all types for free, beginning in Q1 of 2021, and allowing these professionals to set up their entire practices. So, whether they're a EMDR therapist or or clinician or EMDR specialist, whether they are a case manager, a yoga instructor, a nutritionist. We're going to allow them to utilize the app for free, kind of set up their practice, in and on the app. And then if they want to open themselves up, treatment centers that are on our platform will be able to request access to use them as service providers for their program very easily. So they would be able to just request access to their schedule and to book them, and then they would establish a credentialing arrangement between the practitioner and the treatment program, and then utilize them for as much or as little as they'd want to. So those are just a couple of ways. One way that we're planning to offer it, and then just another way that anyone can get started with, right now by just placing job ads for therapists and clinicians that don't have to be located at their physical location.
We have one more question from Alexis, and feel free to ask any more questions to the attendees. But Alexis asks, how are outcomes measured and reported?
Great question. We are, again, I'll speak to us again. Our objective, we're going to be working with one of the leading innovative recovery capital index providers to provide multiple different types of assessments to treatment organizations to push to their users, right? So if a user downloads the app, and whether it's some type of intake assessment or a 30-day assessment or a 45 or 60 or whatever these consistent assessments would be, we'll push these questions out to the user on the app. And by keeping them involved in the app through other ways, right? Community, peer groups, the responses that we expect, and response rates we expect are going to be higher than if we were just to send them an email questionnaire or send them a phone or call them and go through our questionnaire. And then they will get the reports, the organization will get the reports. And then our hopes are to be able to aggregate that data across our treatment organization, our user base, and to be able to publish that, data. Again, that's the direction we're moving, because the other part a digital care platform can provide with proper, again, this comes to privacy, and there's some HIPAA and different concerns and data privacy that come into play, but behavioral analytics are also very important to, I believe, longer term outcomes. So, how many meetings am I involved in communities, peer communities? How many times am I meeting with my peer coaches? How many times am I meeting with my therapist? So there's a lot of data that we can collect above and beyond just your traditional assessment. So it's a very in-depth, powerful question. We want to make assessments and outcomes a center point of what we do through just asking, but also measuring behavior, on the platform. I see another question from one of our members, or from one of the attendees, Addison, and let's see here. I'd like to explore more about the subject being applied to after or during an episode of treatment, concerning the support and strengthening element that recovery and coaching may be able to bring. So yeah, Tim, I think that's a good one for you.
Yeah. I mean, I think, a lot of the things that we're talking about, have been a part of the conversation, including the continuum of care, continuity of care, peer support, community groups, mutual aid support. All that stuff exists in the brick and mortar real world, so to speak. The challenges that have always occurred has been more consistent delivery of remote management. And that we're limited in the real world because of geography, because of ways of contact, because people don't answer their phones, all different kinds of challenges or barriers. Digital allows us to up the ante as far as peer recovery support and coaching of all kinds. And I think this is going to be a very, very strong part of anybody's digital platform, whether you're an individual practitioner who wants to use the app, or if you're offering peer support, recovery coaching through your treatment center. The idea is, how do we continually and consistently deliver care in the digital atmosphere, in the digital universe? What that does is it takes us and it allows us to build bridges between where normally people were falling through the cracks. Digital is a bridge. It's building a bridge between transitions in care, different levels of care, and simply accessing care, right? This is about accessing care. If you have 18 million people who aren't accessing care because of stigma, transportation, timing, convenience, just a comfort level of how they want to talk about their issues. Do they want to be in a group at all? I mean, all of these things are really important. If you can start to tear down these barriers to connection, whether you're a recovery coach or you're a master's level clinician delivering EMDR, this is the way we're going to do it. This is the way we're going to change the present and the future in terms of how people engage in services and ultimately recover and get healthy. We cannot continue to do it and make a dent in the 18 million if we continue to do it the same way. We can't build enough treatment centers. It's not possible, but we can build a lot of virtual treatment centers. We can build a lot of virtual services.
But Tim, let me add to that, not to interrupt. I mean, let's not forget those 70 million people. Let's not forget the people that are adjacent to this issue through just misuse, that have been, that have come up even through this past, 9 months, or this past, this past year. Let's not forget those people that I think that peer coaching and recovery coaching is, probably the most paramount, too.
Yeah, absolutely. In fact, this isn't about, are there enough clients? It's never been about that. It's been about, how are we going to innovate in order to engage more people in the process? We can't do it in the traditional route, in the way that we've been doing it, if we're going to make a dent, if we're going to help more people. So the future is in virtual care, remote care, consistent delivery of services over time that continue to engage people in a process of healing. We cannot reach, and in fact, that number you're talking about, JD, some say is 70 million people who are dismissed until they become addicted. And we don't need to do that, not with digital. We can engage them long before all four wheels fall off, and keep the costs low, keep them out of emergency rooms, keep them out of higher cost care levels. And we can do that with digital, and we're going to do that. But we need the help, and we need the partnership and the collaboration of people who are already boots on the ground in order to exponentially move this along, because time is of the essence, right? We know time is of the essence because people are consistently moving their way into these levels of care that cost a lot of money. And so we want to address that, and we want to impact those million additional lives personally in our company. And we need the help of people out in the community who are influencers, who are already treating, who are already out there helping people. We want to employ them and partner with them to help us reach these goals.
I mean, look, we've had internal conversations, I've had external conversations. I try to be, as transparent about it as possible. And coming from a owner operator of a 4-location detox through outpatient level of care, high end, treatment center, what you would call in Southern California, wanting and starting and doing it all and wanting to do it all for the right reasons. And then, just the way the entire system, is built from the payers all the way down. I would walk through my own facility and I would know right away, this person is been here a couple of weeks. They're equipped, if they stay connected, to go back and to re-engage back with their family, to re-engage back in work. But we continue to push them to stay on site because of financial obligations, right? Well, if we're providing more ways for treatment organizations to treat people, to gain bigger access to these number of people that are affected, we allow them to diversify and better treat people at the right levels of care. So we remove that pressure from them and allow and make it easier for them to do the right thing, right? And that's I think we often overlook that. We need to allow the treatment organizations to do the right thing, and still survive.
100%. Yep, 100%. There's a natural way that this thing moves, and with digital, we can allow it to move naturally instead of intervening and holding on to or pushing people to do more than they really need to be doing. And let's not forget people who leave treatment early. That's a huge issue in the field. People who don't finish a course of treatment, they leave against treatment advice, medical advice. That's a huge number. If they're connected to us through a virtual platform, we have an opportunity to continue to engage with them as well, where otherwise they'd be lost, they'd be gone, and we would not be able to communicate with them the way that we can through a digital platform. Because I'll tell you one thing, we talked about this early on, is that people come into treatment oftentimes with not a lot, but they always have this.
Yeah.
They always have this. They
Yeah.
come with it. They leave with it. And this is just the world we live in. And we get to, as somebody said the other day in an article, they said the answer is literally at hand in terms of how we move forward as a field and how we innovate and innovate to the opportunity of something like this. This isn't about engaging in more treatment, but it's engaging in more valuable treatment. Not just more, but more valuable treatment that actually moves people along the continuum and gets them healthy. This has been great. Thanks, JD.
Yeah, I wanted to, thanks Addison for moderating, administering. Tim, thank you for joining me on this today's discussion. Thank you to everybody that attended. We hope that we delivered some positive or some good information. And again, this is a first in a series of webinars that we'll be offering entering into 2021 and beyond. So don't be a stranger. We hope you got something out of it, and let's go out and positively impact 1 million lives. Thank you very much.